So I believe that the majority of my chronic illnesses were caused by the many years I spent on the low-dose birth control pill. I was put on oral contraceptives at age 15 to start my periods. It was the low-dose pill, and I was on it for most of the next 15 years. So the primary way the pill caused me problems is that it suppresses ovarian hormone production of estrogen, testosterone, and progesterone. I'm going to read the tiny writing. The pill has been shown to lower serum levels of these hormones, estrogen and progesterone, even after discontinuation. And postmenopausal women who have used the pill have lower levels of androgens and estrogens than those who have never used it. The pill basically perpetually keeps you in an artificial area of the first week of the cycle where the hormones are lowest, but you're also getting synthetic hormones, and synthetic estrogen has a more powerful impact on, for example, the liver. Synthetic estrogen's powerful effect on the liver causes it to produce up to 3 times more sex hormone binding globulin than normal non-pill using women. So my first problem was chronic UTIs and followed by a painful bladder syndrome IC diagnosis. This is a urological article, and it says right here, estrogen depletion associated with natural menopause, contraceptive use, which causes estrogen suppression through negative feedback on the gonadal axis. So this estrogen depletion has a direct impact on female lower urinary tract and the vagina. It's well documented that the birth control pill can cause vaginal dryness. That's because of its effect on your hormones. This article is by the Cleveland Clinic. It says when estrogen levels decline, the skin and tissues of your vulva and vagina become thinner and less elastic, and your vagina can become dry. It says right here that birth control pills can cause that. So for people in menopause without circulating estrogens and androgens, but for someone on the oral contraceptive pill, that would just be reduced levels of circulating estrogens and androgens. There's a loss of collagen and elastin, diminished blood supply, and a loss of an acidic environment that's in the vagina, the microbiome, which changes the entire ecosystem of the genital and urinary tract. Because of these changes, women develop urinary frequency, urgency, dysuria, pelvic pain, and recurrent UTIs. Additional symptoms include vaginal dryness, dyspareunia, that's painful sex, and difficulties with desire, arousal, and orgasm. So there's a lot of factors about how the pill affects some people differently than others, and also different pills affect you differently. Like the low-dose estrogen pill actually has a worse impact on vulvovaginal and urogenital structures because it actually suppresses estrogen more. And I'm someone who I know for a fact had very low estrogen to begin with and had extremely low estradiol on all my blood work taken as an adult. I mean, when I was put on the birth control pill at 15, I had amenorrhea. I wasn't getting a period because I was an athlete and I didn't have any body fat and I just wasn't really developing. So my PCOS diagnosis was based on the ultrasound with the string of pearls, which is now not really part of the diagnostic criteria because they found that that can exist in a lot of different people. And most of the symptoms that got me that diagnosis were actually just signs of low estrogen. And even though high testosterone is often a diagnostic criteria, the fact that I had below normal free testosterone that year, my doctors just completely ignored it. So I didn't have PCOS, even though I had almost all the symptoms. I actually just had suppressed estrogen and testosterone. So a lot of my terrible symptoms, the way my periods were, late, missing, really painful, dry, the acne, the hair loss on my head, the hair growth on my body, the frequent UTIs, a lot of the vestibule pain and the vaginal pain and the urinary frequency and urgency was all caused by insufficient hormones. And all those issues have been not completely resolved because of some other stuff, but a lot of those symptoms were totally resolved by getting off the pill and starting hormone replacement therapy in 2016. But before I learned about all this stuff, I had that PCOS misdiagnosis, and I thought that I needed to be on a higher estrogen birth control pill to counter that. And so then that caused me the 2 other problems that I lived with for a while, gallbladder dysfunction and occipital migraines. I also have reason to believe that the low levels of estrogen that I had, endogenous estrogen, was affecting my ability to fight off viruses, and kind of explains why I had so many sinus and throat infections for several years. It also affects how the body immune system responds to bacterial infections. I also had symptoms of Sjogren's syndrome, which is dry eye, dry mouth, just dry everything. And there's evidence that low hormones are related to that too. This was a study that showed that women with primary Sjogren's syndrome have lower estrogen exposure, and that increased estrogen exposure was negatively associated with the development of Sjogren's. When it comes to clitoral adhesions, which is the condition that caused me to need the procedure that left me with nerve damage, a history of hormonal birth control use is the main factor in common with all the patients in this survey of needing clitoral lysis because of adhesions. Lichen sclerosis is way less of a common denominator than the birth control pill. So I think that not only does the pill cause vaginal atrophy, it can cause clitoral atrophy, and that atrophy can cause the prepuce, the hood, to over time stick to the glands and cause that unfortunate situation.